Welcome to this episode of Substantial Matters, Life and Science of Parkinson's. I'm your host, Dan Keller. At the Parkinson's Foundation, we want all people with Parkinson's and their families to get the care and support they need. Better care starts with better research and leads to better lives. In this podcast series, we highlight the fruits of that research, the treatments and techniques that can help you live a better life now, as well as research that can bring a better tomorrow. Living a better life with Parkinson's is not just about managing the medical components of the disease. It also involves supporting every aspect of daily life. And that is where occupational therapists, or OTs, come in. Occupation, in this sense, doesn't refer to work, but means what you occupy yourself with in daily life. As part of a comprehensive Parkinson's team, OTs are allied health professionals with the training, expertise, and creativity to help people solve both the big and small physical or mental challenges of daily living, from taking a shower, getting dressed, or opening a can in the kitchen. I spoke with occupational therapist Carissa Silva of Aldersbridge Communities in Rhode Island to better understand where OTs fit into the healthcare team and how they provide solutions to problems that people with PD may have in their daily lives. Why don't you tell me a little bit about yourself and what inspired you to become an occupational therapist, and especially a focus with Parkinson's disease?
So I have been an occupational therapist now for about 15 years. I first went into the field strictly wanting to work with children. My brother was diagnosed with a sensory processing disorder, which is now a part of the autism spectrum. But when he was first diagnosed, it was not considered an autism type diagnosis, I guess you could say. So my plan was to strictly work with children, and I did quite a few placements of field work that is required by my degree in the school system, and I loved it. And then I kind of faced my fears and had to go to a placement that worked with a geriatric population and ended up falling in love. I was provided the great opportunity to work. Even before I had graduated, I was offered a job from the rehab director at my placement before graduation and before passing my boards, which is standardized tests that need to be taken. And I have not left the geriatric or older adult population since. I haven't stepped foot back into a school unless it's for one of my children. And I'm just as happy as I was on day one, which is great.
You've worked at both ends of the age spectrum. What is it that you particularly find rewarding or attractive with the geriatric population?
It's OT in general, to be very honest, that I find the most rewarding. And with that being said, it is the fact that you see the progress that people make and make in themselves. And it doesn't matter which age group you're really talking about. You know, you're working with the younger generation, and they're finally able to have great legible handwriting that their teacher and their parents are so proud of, and you can see that gleam kind of just beaming off of them. And the same goes for the geriatric population or the older adult population. It's being able to do the task that they were once doing on their own or that they could remember doing, and being able to do it again, whether it's slightly modified or not. It's just that rewarding factor of, I've got this, I can do this, and that self-confidence that just really comes off.
When do you recommend that a person with Parkinson's see an OT, and how do they find OT services?
So that's a really great question, because not everybody with Parkinson's knows to look for an OT. Occupational therapy, I call it the bridge between physical therapy and speech therapy. Everybody knows that physical therapy is going to help them get walking and relieve any type of pain that they have. And speech therapy will help people with their swallowing deficit or any type of cognitive deficit. So what is left for OT? And that's what's so great about OT. So OT plays a vital role in helping people manage symptoms or whatever they're having a difficult time with to stay independent within their daily lives. So, yep, you can walk to the bathroom, but are you able to have the balance to go to the bathroom or get in the shower or be able to do things independently? That's where OT really helps with people with Parkinson's. To answer your first question, anybody with Parkinson's should see an OT as soon as they are diagnosed because they saw something or something was brought to their attention that made them go out to kind of look for a diagnosis or an answer to why things were happening. A lot of people have told me that it's happened with handwriting. They saw a difference in their handwriting. It was getting smaller, it was getting illegible, and they couldn't figure it out. Or somebody was, walked miles, had a walking partner, and all of a sudden the walking partner said, "Why aren't you swinging your arms? That's not really common for you." It's things like that people are being told or recognizing in themselves that is causing them to reach out to doctors for a diagnosis or just for an answer. And that's when you should see an OT, because OT can help with symptoms that are so minute but making a difference in your life.
Would the doctor refer out to an OT? Is that a good way to find someone in the field?
Certainly. I don't know, honestly, especially after speaking to a number of neurologists, if the neurologist would automatically think, let me get you into an OT to see. They certainly can. And typically with any outpatient or home health, you would need a doctor's referral, and that could come from your physician or your neurologist or whoever you see as managing your Parkinson's diagnosis. But I don't think that they would think right off the bat, let me get you into an OT, just to kind of fine-tune those little tasks that are getting more troublesome for you. I think it's kind of knowing and having that knowledge of what OT is and seeking out that referral. I haven't had a doctor yet tell a patient, I think you should wait to see an OT. They're usually very happy to sign that referral over. But it is more self-advocating or a caregiver advocating for OT.
You named getting into the shower as one challenge, or a person noticing they have smaller handwriting. What are some other common challenges people notice or someone else brings to their attention?
We know with Parkinson's that it's a motor disorder, so people have a harder time moving. And right off the bat, typically, people know that. What they don't realize is how it can affect cognition or how it can affect the internal depression, anxiety of not wanting to go out in public. So what we see most is that I'm walking fine, I can get dressed fine, I can get in and out of the shower. Yes, my handwriting is getting smaller, I'm not swinging my arms, but it's getting people to realize that what that could cause. So not swinging your arms, you're not walking as fast as you were, which is preventing some people from going on the walks with friends around the neighborhood like they were, causing more of a depression than what the disorder can already cause. We also see that if you're not swinging your arms, it could throw your balance off and people are falling, causing them to have some type of knee injury or a wrist injury or, oh my goodness, I'm falling, I can't go out in public because what happens if I fall? So we see a lot of the internal issues that we're dealing with people, as well as even fine motor, gross motor, fine motor problems that people are having.
With those challenges, can occupational therapy make a difference? Can they be remediated? Maybe people aren't swinging their arms and they're almost unaware of it, but with intention, say, can they learn to walk with a better gait?
Absolutely. Absolutely. And the earlier you find these difficulties, the easier it is to fix or correct or adapt to those difficulties. So people not swinging their arms. As I mentioned, I am LSVT certified, and that is one of the big things that we do with people. It's called big walking. And it seems a little crazy. I've had people who have told me, I am not walking in the grocery store like that. And you're right. You shouldn't walk in the grocery store with, these great big arm swings and this gait length that is a little exaggerated. However, what feels exaggerated to somebody with Parkinson's typically looks normal to somebody that doesn't have Parkinson's or that has no idea any type of disorder out there. So it might feel really big to them, but it doesn't look as big as it feels. So things like that can be corrected, and that's why caregiver education is huge. If you go to the store with your loved one or a friend and having them in a session or two to be like, hey, make sure you get your big walking in or swing those arms. Sometimes we need those reminders, and everybody needs gentle reminders all the time to do things. So it certainly is correctable or at least adaptable.
What does a first meeting with an occupational therapist look like? What should someone expect? And what happens during an evaluation?
So the initial OT evaluation is just a way for us to get to know the person, know what their routines are, what they're looking for, what they want from us. It's a lot of explaining what OT is. We see how the person is moving. Either if it's home care, then we see how they're doing in their own environment. Typically, the home care evaluation will look like how you do getting in and out of bed, in and out of your shower, in and out of your favorite chair. If you're a big gardener, making sure how you do getting in and out of the house to go to the garden. We are focused on the person. And every therapist is, but we are really focused on what is most valuable to you and what we need to help you do in order to be as successful in life and do those things that you want to do. It's a lot of question asking and seeing how somebody maneuvers, whether they get fatigued and how quickly they get fatigued, and their sequencing of tasks. So if they are a gardener, what steps do you need so that you're not going back and forth to the garage to get the tools you need? And it's mostly just observing. And then going forward, it's how are we going to correct or adapt, or what is the best way for you to be able to get this task done that means the most to you?
People operate in a big sphere at home, at work, social settings, things like that. To evaluate someone comprehensively, is a home visit recommended, or can you do it virtually, or do you just talk to the person and they tell you what they're having problems with?
I know we live in 2025 and virtual has now, since COVID, become a big thing. I don't love virtual visits. I don't feel like it's as interacting as possible or as I prefer it to be. And again, this is just my preference. It can certainly be done in a clinic, in an outpatient clinic, mostly because you're seeing how the person moves, not within their own environment, but you have the resources as far as strengthening in the machines and the tools to help that person target the certain muscle groups that you need in order to do the task that they love. Of course, seeing somebody in their home, like you said, that's their environment. That's how they maneuver. So in-home is great, but an outpatient clinic would just suffice as well.
Do you recommend to them any ways to modify their home environment for better function and things like that? I've noticed as the population ages, a lot of home improvement stores have seen a market there, and they've got a lot of assistive devices, and the big online retailers have it. So are you a resource for ways that they can modify their environment for better function?
Absolutely. Absolutely. So home evaluations are something that OTs are pretty well known for. And again, we could do a virtual home evaluation. I like to see the person in their home to see how they're doing, because sometimes they don't realize that it's that one rug that they're tripping over or is moving under their feet that could not be as safe. But people have brought us in pictures of their home or measured, this is the lip of my tub and I'm having a hard time getting over this lip. So if I'm making up inches, but if it's 4 inches, we make sure that if we're in an outpatient clinic, they're able to step over something that is 4 inches high. And it's really a lot of caregiver education. It's a lot of finding that one person that is going to be your support person that you can really rely on so that we can go back and say, we've all been to the doctor's office and walked out and said, what did he say about that? What did they say? And so it's having that other person or even asking the therapist to write down our total recommendations of what to do for the bathroom, what to do even in your bedroom, or how you can adapt the simplest chair or wicker chair that you love sitting out on your porch. Definitely, we could definitely help with home evaluations and just giving those ideas, little things that you wouldn't even think of.
We've recently had a podcast that talks about preparing for a doctor's visit, being at the doctor's visit, and after the visit. So that might be something that people also want to refer to back on our site. What do you find yourself recommending most, maybe in general? What kind of tips or tools?
That's a good question because it truly relies on the person and where they are in their Parkinson's journey. It really depends. One of the biggest things I think would be a support group. I've talked quite a bit about the intrinsic feelings of depression and anxiety, but it truly is knowing that you're not alone and other people are very creative and have come up with ways that they've handled things or adapted things that have helped them that I've seen come out in support groups. And same thing for the caregivers. Caregivers seem to put themselves on the back burner, and it can be more daunting than helping. So having a caregiver support group or, even if it's an online chat or just somebody that can relate, that is one of, I think, the biggest things I've recommended. Obviously, besides small things like Theraputty that you can get on Amazon that helps with fine motor strength and grip strength and sit to stand type exercises or machines that help with lifts. Those are probably not as much as I've recommended, but the smaller stress balls and small things like that. Nothing expensive. It doesn't have to be fancy. It just has to all be about function, truly.
People have problems with various conditions, multiple sclerosis, Parkinson's, with clothing and dressing and shoes and things like that. Buttons and zippers are not easy to operate, small, fine motor function. But now there's clothes with Velcro closures, magnets. So does an OT get into that arena?
That's our realm. That is us. If you had to, one sentence like that you just said that describes OT, that is us. That's what we do. We make things that you have to do to be a functioning human in society easier for you. So whether that's a sock aid, which is a mechanism that helps you put your sock on if you can't reach down or you don't have that fine motor strength to really get it over your feet. Dressing sticks, which can be a little difficult for people. Those are a little bit of the old school type of OT, but absolutely Velcro, elastic shoelaces, magnet, like you were saying. People have come up with numerous ideas of how to just be able to get out into society and be who you were before your diagnosis.
My father had had a hip replacement, and he had problems with it. It would disjoint, especially when he was trying to bend over to tie his shoes. A simple solution was get loafers and get a long-handled shoehorn. That solved the problem.
Exactly. I had a gentleman who could not, he lived alone, he could not open jars. Could not for the life of him open jars. And he came up with this vice type mechanism that stuck on his counter. I got him some Dysum, which is really like a cabinet liner. It allows for, it's an anti-slip type of fabric or mat. And with that, with his Vice and my Dysum, he was opening every jar that possible that he needed to open. So, like I said, OT isn't fancy. It's not about fancy equipment. It's really about function. And if it's functional to you, then let's do it. Let's figure it out and come up with a way for you to be able to do the things that you need to do.
Sounds like there's some creativity in this. Stand back, look at the problem, and find the solution, which doesn't have to be high tech. What's the one thing you wish more people understood about occupational therapy and its role, especially in Parkinson's care in this case?
I wish people understood that we are just as valuable as the PT that you're seeing. I love my PTs and I love my speech therapists, but we are just as valuable in your entire journey. We can help, like I said, from day one until the day that it's getting more difficult to even get out of bed. We can tailor any type of plan, exercise, task. We can tailor it. That is us. In school, we learned about the Just Right challenge, and that was drilled into us for years, making sure that that person is challenged just enough, but can still complete the task as needed.
We had a podcast episode with a clinical social worker, and he described social workers as the yellow pages of services. They know where to direct everybody. It sounds like you're sort of the yellow pages of daily function.
Absolutely. Absolutely.
Is there any nutshell message to people who might avail themselves of the services of occupational therapists but are not yet doing it?
Absolutely. Give it a shot. It will not be a waste of your time. And if you don't feel stronger, I think that's really where people hold up. For PT, my knee replacement is your dad's hip replacement. I'm sure his hip was sore after he was done with his PT, but he could feel it getting stronger. OT is the same way, but your muscles aren't really going to hurt. It's not that, I just worked out and I'm feeling stronger and I'm running up these stairs like I was when I was 20. We aren't so much doing that, but we're going to make sure that your shoe is tied so that you can run up those stairs without falling. It's little things that we're not just adapting to your loss. It's about staying active. It's staying independent. It's staying engaged. We make things easier for you so that you can go on and go to PT, I guess you could say, and have your muscles sore. So some people walk out of OT and they're like, I don't really feel any different. You won't, but you're going to notice the difference if you give us a shot.
Great. I appreciate the information and all the time, and I'm sure you've kind of enlightened people to another service that maybe they just hadn't thought of before to solve some problems they already have. Thanks a lot. Take care.
Absolutely. Thank you.
To find an occupational therapist, you can ask your doctor's office, a local hospital, or a university occupational therapy program. Whomever you find, just make sure they have experience working with people with PD. You can also speak with our helpline specialists. As we mentioned in the interview, you can find many assistive devices online or locally to help improve your home environment. Home improvement stores are also another option. Just search their websites for assistive devices. 2 of our past podcasts may also be helpful. As Carissa said, people sometimes walk away from their OT appointment and wonder if they missed something that was said. One podcast called Make Every Minute Count, Optimizing Your Parkinson's Doctor Visits, applies just as well to a visit to the OT. In the show notes, we include a link to a worksheet to help you organize your thoughts to make the most of your time with your doctor or OT. To see a recent webinar on this topic, visit parkinson.org/PD library and search for Taking Charge. Finally, another past podcast called Aging in Place shares ways to modify your home to fit your needs and find a suitable area to live in so you can stay in your own home as long as possible. As always, our PD information specialists can answer questions and provide information in English or Spanish about this topic or anything else having to do with Parkinson's. You can reach them at 1-800-4PD-INFO. If you have questions or want to leave feedback on this podcast or any other subject, you can do it at parkinson.org/feedback. If you enjoyed this podcast, be sure to subscribe and rate and review the series on Apple Podcasts or wherever you get your podcasts. At the Parkinson's Foundation, our mission is to help every person diagnosed with Parkinson's live the best possible life today. To that end, we'll be bringing you a new episode in this podcast series every month. Till then, for more information and resources, visit parkinson.org or call our toll-free helpline at 1-800-4PD-INFO. That's 1-800-473-4636. Thank you for listening.